भाई कोई वो है क्या रूम फ्रेशनर वगैरह मेरे पास मेरे पास
Sir, please let us know whenever we can start. Manoj, sir.
तेरे तो फिर बंद हो जाएगा साहिल भाई
क्या?
4.3 GB दिखा रहा है स्पेस को
कछो नहीं कर कछो नहीं कर सकते भाई। अभी देखना पड़ेगा अभी तो। अभी ये काम कर ले, इनका दीक्षा का वो ले ले, दीक्षा का हटा दे वो।
बाहर रोटी रखा क्या है तो बोलेगा ना रोटी रखा दिया
तो नीचे कुत्ते को डाल देना। क्या?
तो ओए ओए
अनम्यूट क्यों है? म्यूट है भाई। हाँ?
Afternoon, all the participants and making them to attend this event. This is our third webinar in the series of 5 webinars. These webinars are organized on occasion of our 10th Ayurveda Day celebration as uh, desired by CCRS Ministry of Ayush to conduct the webinar series and one webinar conference in the whole these 2 weeks time. So today is the third webinar. I welcome all the participants and today's guest speaker and our institute head, Dr. R. Govind Reddy sir. So I request Dr. Govind Reddy sir to give the welcome address. Over to you, sir. Sir, you are muted.
Om Dhanvantaraya Namaha. First of all, I thank to the Dr. Manohar, Technical Officer of my institution, for this conducting of this webinar series. And very good afternoon to all, and a warm welcome to all the participants, especially my CCRS officers is there, many medical colleges, faculties, teachers, many are attending. So it's more than 1100 participants registered for this third webinar. And first of all, I am very thankful to the Honorable DG Sir, Vaidya Rabinaran Acharya ji, and Honorable DDG, Dr. N. Srikant sir, for giving the opportunity to conduct this integrative oncology webinar for my institution. So this is, I am very happy to conduct this because we have conducted two webinars 3 days back. and today is the third webinar. So in the first webinar, it's more than 1,300 registered participants, and even second webinar, so more than 1,100. And today's webinar is more than 1,100 participants participated and registered for this webinar program. And I am very, very happy to for today's third webinar. It is a very good speaker of today's Dr. Shankar Prasad Ji is a really integrative oncologist because he did MBBS, MD, DNB in general medicine, and he did BAMS and MPhil in Ayurveda. I know him since many years, and he is a very good practitioner of integrative oncology, Ayurveda. And my entire this my regarding my institution is also we are doing a lot of work since 13 years. This Mumbai Institute is mandate for the cancer. So we have the very special OPD breast cancer screening OPD, and even IPD patients. Many patients are admitting for the cancer, and many patients are referred from especially for the modern hospitals like KEM, Nair, and even Tata also. So we are getting a lot of patients. Some of the patients they are coming mouth to mouth advertisements, and they are coming only for the Ayurveda treatment. They don't want to do the allopathy. That patients is also there, and even left out cases. We are doing a lot of post-operative, post-chemo, post-radio complications. We are treating with our panchakarmas and with Ayurvedic medicines, and especially for this Mumbai Institute. So my technical in charge, Dr. Manohar Ji, is we are very proud to in the even CCRS also because Honorable Secretary and Honorable DG Sir is giving the more opportunity to work on the integrative oncology, and my scientists, almost all scientists, so they are working, and with the Honorable Secretary has initiated this joint clinics at TMC. Since 2 years we are working, and recently Honorable Secretary Sir has inaugurated the Ayush clinic at TRAC. So we are doing a lot of clinical trials, even in vitro, in vivo studies. We have screened some of the anti-potential cancer drugs of for anti-cancer activity of almost all. We published that book of monograph of so it is available also in the CCRS, and many that means mechanistic studies and even in vitro, in vivo studies and single drug preparations. They are starting even in the clinical trials, ovarian cancer with Prakriti. So we are doing a lot of work on that area, oncology, and we are coming up for 2 hospitals. It's one is at Bandup and one is at we are the collaborator of TMC Tata Memorial Hospital and ATRAC and upcoming hospital of the Kopoli also. So the Ministry of Ayush and Carry Mumbai is totally fully involved, and we have the more than 20 different institutions. So we are the collaborators for this, and I will thanks to the all the participants. They are giving the more enthusiastic to participate in especially for the integrative oncology. And recently, Goa government has invited to participate with the integrative oncology at Goa. They invited the Dr. Manohar Gundeti ji and my entire team. I'm thankful to for this opportunity for this integrative oncology program. And thank you very much. And thank you, Dr. Manohar.
Thank you, sir, for your welcome address. Coming to the webinar now, it's my privilege to introduce Dr. A. Shankar Prasad. Dr. Shankar Prasad is one of the rare physicians holding dual qualifications in modern medicine and Ayurveda. He earned both his medical bachelor's degree, MBBS, as well as his master's in internal medicine, MD, at Gandhi Medical College in Hyderabad. He also earned the degree of Diplomat of the National Board of Examination, that is DNB, in General Medicine in 2001, after working as a consultant in the Department of Internal Medicine and Critical Care at various prestigious institutions in Hyderabad. such as Medicity Hospital, Care Hospital, and as an assistant professor of medicine at Gandhi Medical College. He started to pursue formal Ayurvedic education by completing BMS at Vagdevi Ayurvedic Medical College in Warangal, and also by completing MPhil in Ayurveda at Pune University in Rasashastra. He also pursued traditional Ayurvedic learning with Vaidya Shri Pradyumnacharya Nilangekar and Vaidya Shri Itikala Sanjeev Rao in Hyderabad for 9 years, and trained with Dr. L. Mahadevan and at Vaidyaratnam Ayurvedic Foundation in Thrissur. Currently, he is the director of Siva's Health and Research Institute in Sikandrabad, and also is a senior consultant physician at Kim's Sunshine Hospital in Hyderabad. He is a visiting faculty at EKSMHA at IIT Mandi. He is actively involved in research in the area of immunology, infectious disease, mental health through the principles of integrative medicine based on the wisdom of Ayurveda, Yoga, and Vedanta. So this is a brief introduction of Dr. Shankar Prasad, very nutshell, but it is something like a compressed biodata, but he will go through his lecture, so we can have his pearls of wisdom. So I request Dr. Shankar Prasad sir to start his presentation. Over to you, sir. And before that, I want to make few request. One is please mute yourself, all the participants. Please mute yourself until unless it is needed. Don't try to unmute yourself. And we will be taking a question answers after the lecture of guest. And in between, you have any queries or questions, please post in the chat box so that that can be taken after the lecture session. So, and also I want to inform you that this session, as we have a limited participants on the WebEx platform, so the same event is being live streaming on YouTube also. I have posted the link on in the chat box. So please, you may feel free to share this YouTube live streaming to the one who is interested. With this, I request Shankar Prasad sir to start his lecture. Over to you, sir. Thank you.
Thank you very much, Sri Guru First of all, I would like to thank Dr. Govind Reddy sir and Dr. Manohar for actually inviting me for this webinar. Dr. Manohar has been known to me for many years, I think dating back to more than 25 years now actually. And it's always a pleasure listening to him and talking to him. So thank you for giving me that pleasure, sir. So, and I'll be, so getting into my presentation, I will be talking about integrative oncology, particularly trying to look at it from two perspectives because I had the fortune of getting exposed to both the systems and quite quality exposure from both the systems. So first of all, the first question that is asked is there a need for integration? This question I'm discussing from the modern medical side because many people say that do we need an integration with somebody else? There are people who call this as mixopathy, who are strongly against it, etc. They have their own reasons as well. So for that, I just want to tell them a few basic facts. First thing is the cancer burden worldwide. We have 53 million people diagnosed with cancer right now, as of 2023, according to the WHO. 20 million cases are getting added every year. So that's 2 crores every year. The overall cancer mortality is 9.7 million every year, right? Lifetime risk is 1 in every 5 of humanity is going to get cancer. The projected growth is we'll have 33 million cancer cases by 2050. So it's a pandemic. It's the new pandemic. Gone are the days of influenzas, gone are the days of COVIDs. Now to say the new pandemic is cancer. What about in India, where we are actually discussing? 1.46 million cases are added every year, and out of which 0.92 million of them die, which means 3 out of 5 cancer patients do not survive. That's an astonishingly high mortality rate for any disease. So very high incidence, very high mortality obviously shows something is not right with the ongoing treatment. If we had very good mortalities, maybe yes, there is no need for integration. Right. The other thing is, where are we heading as a country? there's a rapid urbanization. In 1901, we had 11.4% which was urbanized, living in cities and towns. Right now, we have 36.4 living in urban areas, and this is going to increase to 40.8 by 2030. That means 4 out of 10 people are going to live in cities. And cities, as described by Robbins' pathology, are the dustbins of human civilization. So we have 4 out of 10 living in dustbins practically. So we need strategies to prevent cancers in such a highly contaminated and urbanized environment. Third issue is the cost of modern medical care that is happening. Usually, if we talk about Indian statistics, it might take, depending upon the scheme that they're applying to, depending upon the place they're approaching, it might take less than 1 lakh rupees to up to 27 lakhs per annum as the usual cancer care. For surgery, it usually costs anything between 1 to 5 lakhs. These are very conservative estimates. If in metropolitan cities, this is nothing. It will be finished on the day 1 of surgery. Chemotherapy takes 10,000 rupees to 2 lakhs per cycle. Again, this is just a basic estimate taking pan-India averages. These are averages given by one of the leading insurance companies that caters to India. Immunotherapy, basic immunotherapy is something like 10 lakhs, 10 to 12 lakhs for the first 5 injections. The rest of them are supplied free. It goes up to 1 to 1.2 crores. Yeah, somebody needs to mute, please. Yeah. So,
yes, I will be doing when there is a necessary.
Yeah. So if we go into an advanced therapy like a CAR T cell therapy, it's costing 1.2 crores to 2 crores for the complete course, at least in a city like Hyderabad. Radiation costs 2 to 5 lakhs rupees. So it's a pretty expensive affair. And after all these costs, what we are seeing is a mortality rate of more than 60%. So that's something that everyone has to think and introspect. If we can do something, we can do better on any sphere. Finally, the least discussed aspect from modern medicine is the philosophy of medicine. Nowadays, we rarely speak about it in modern medicine. But in critical care, when I learned critical care, the first thing that was taught to us was primum non nocere. First cause no harm. If you cannot do benefit to somebody, no problem. But if you cause harm to somebody by means of your treatment, then something is wrong with you and you need to update that, you need to change that, and you need to get away from that. And another very beautiful quotation that I always love, that we were taught in our medical college days, is from Sir Robert Hutchinson. A very lengthy one. He says, from making the cure of a disease more grievous than the endurance of the same, good laws deliver less. So he's a very beautiful quotation. I'm sure many of them would know this as well. But very specifically, he says at the last, he says, we should not be making the treatment of a disease more grievous, more injurious than the just endurance of the disease. Unfortunately, this happens many times in cancer care, and that's an unfortunate reality. Again, I come to the second part of the question. Again, do we need integration from Ayurveda? Because many people believe in Shuddha Ayurveda. Again, people say that we should not be mixing up things, even from the Ayurvedic sector. Although this is a minority, and I appreciate that particular section of them. I have a lot of respect. But again, there are 2 or 3 issues that we need to, there are a few issues that we need to look at from this. One is the asadhyatva of the vyadhi. Charaka Sushruta say that when there is adhyar buddha, it is asadhya, which means technically any disease in stage 3, stage 4 is asadhya. So what do we do with these asadhya patients? You have the classical Charaka saying that please don't touch them if you expect ardha, vidya, yasho, hani. If you don't want to undergo all of these things, don't touch them. Upakrosha, people cursing at you, please don't treat them. Asangraham. So if you don't want all of these things, don't treat them. This is one school of thought which is classical. But we need to know, those were the days when people believed they are the self and not the body, and death is like changing clothes. Now, I do not know if you have 1 person in a million who believes in this at this point of time. So we have the next understanding which says, Yavat Kantakata Pranaha. So as long as there is life, you should keep trying, you should keep trying to treat. So now we are forced to treat more stage 3 and stage 4 diseases, which Charaka clearly said don't touch. Now what do we do with them? So obviously we need inputs from a lot of places. We need to accept whatever is coming our way. to handle that. So the next consideration, diagnostic difficulty. An early lung cancer or an intra-abdominal tumor. How many of Ayurvedic Vaidyas are in a position to pick it up, let's say with Nadi or with history, because by that time the tumor is asymptomatic. So that means we have to use some technology. We need to use something to diagnose early, because early diagnosis is very, very crucial in cancer. Then we have the guiding philosophy of Charaka and Vagbhata himself, who says, Satatadhyenam Vadaha Paratantra Avalokanam Tadvidya Acharya Sevacha Buddhi Medha Karokana. One of the most important things in a Vaidya is to have a proper Buddhi and Medha, intelligence which can see through the darkness of the ill health. So, Vagbhata is clearly saying Paratantra Avalokanam. Now, my question is, if Vagbhata or Charaka were born now, today, would they stop from considering modern medicine as Paratantra and stop looking at it? And would they say that, no, we don't want to look at it? In my personal opinion, I don't think they would ever do that. A person seeking knowledge is always looking for better and better ways to understand the disease and consolidate his own position on truth. So therefore, there is a need for integration. Now we come to the question, what is integration? How do we integrate? In this, I believe there are two types of integration. There's a system-centric integration. There's a patient-centric integration. So what is a system-centric integration? One, you want to integrate Ayurveda with modern medicine. Modern medicine is the adhara there. It is the support there. It is the major thing there. And you want to supplement with Ayurveda. That is one type of integration. Second type of integration is we want to integrate modern medicine with Ayurveda, which means Ayurveda is playing the major role there and modern medicine is playing a supplementary or a complementary role. These are the two kinds of intervention that people sitting across this forum should envisage, whichever side they're coming from. And then we have the third kind of integration, which is called as patient-centric integration, wherein the patient is the center of the whole, the system is not in the center, but the patient is in the center. Now, I'll give an example of both. Integrating Ayurveda with modern medicine. This is very popular many places. For example, use of curcumin. Many practitioners use curcumin even across the US, or even use nutraceuticals. They call it as nutraceuticals like ashwagandha, shatavari, whatever, etc. as supplements. The usual cancer therapy is going on, chemotherapy, radiotherapy, immunotherapy, whatever, but you just add a little bit of Ayurveda and say, fine, we're done with this. Then we have modern medicine being integrated with Ayurveda. Typically, this we see in the form of diagnostic modalities. Somebody is using potali, somebody is using different kashayams, panchakarma, whatever is the modality that is being chosen. But they're monitoring with the help of a laboratory investigation, a CT abdomen, a PET scan, something that is technically a part of modern medicine being used for betterment of Ayurveda. It is being integrated with that. Then you have the third type, which is the patient-centric integration, which I am fond of, wherein there is a selective and rational use of either systems or both systems with a proper understanding by a capable person. So please understand, there are many ifs and buts in this. So it is a selective and rational use of either or both the systems with a proper understanding by a capable person. My example for this always has been what Dr. C.P. Matthews has been doing, a great gentleman who passed away recently. He was a surgical oncologist or a radiation oncologist who, out of passion for understanding how natural systems work, spent a long time trying to master Siddha and Ayurveda, used them extensively, and used commonly mixing many chemotherapeutic drugs with Ayurveda and giving results to for a reasonable number of patients. So that is a patient-centric thing, wherein you're not particular with the system, but you're looking at the patient and what is in the best interest of the patient. Now, I will the next part of my talk, I'll just focus upon when modern medicine people, an oncologist wants to integrate in Ayurveda, what are the things that he should know? What are the things that he should be aware of? Now, many people think the problem with modern medicine is drug-oriented. So when I talk to my modern medicine colleagues, the first question they will ask me is, Do we have a medicine for this? Do you have a medicine for arthritis? Do you have a medicine for cancer? And everything. So I want to tell them, actually Ayurveda has a lot more to offer than actually a particular magic pill or a particular magic cure. What is the first thing that it offers? The most unique thing it offers is Nidana. Nidana basically means etiology of a particular disease. Ayurveda has been defined by Charaka as Hetulinga Aushadha Jnanam Swasthatura Parayanam Trisutram. He says the fundamental aspect of Ayurveda is knowing the hetu of a disease, the cause of a disease, the linga of a disease, the symptoms of a disease, and the aushadham, the treatment of a disease. So the uniqueness is Ayurveda is one of the few systems on earth which talks about why a disease is occurring in the first place in a person. So that's the first thing that it can give, and this aspect has helped me tremendously in my practice, irrespective of which system I was practicing. So, for example, a typical case study that I want to tell you is, recently I had a 40-year-old software engineer who was a non-smoker, non-alcoholic, faced no irritation, had no previous illnesses, did not use any medications, was HIV negative, did not have any Epstein-Barr virus, did not have anything, but practically asymptomatically, he just went to a health checkup and they detected some lymph nodes, some LFT abnormalities, and finally worked him up. And he was found to have a high-grade B cell non-Hodgkin's lymphoma with CNS infiltration. So, from a modern medicine friend, there's nothing wrong with this guy. Cancer is just happening to him without any cause. And that's scary, to say the least. But if you take a proper history in him, this guy has been having a chronic and severe asymptomatic disease with severe GERD and dyspepsia. He had very irregular eating hours. You can't believe it. This guy starts work at 6 a.m. in the morning. His work is over at 2 a.m. in the night, in the midnight. He's working literally for 20 hours in a day. And there's chronic severe sleep deprivation for many years. So his lifestyle has been terrible. It's all over the place. But in the conventional risk factors, this is never taken as a risk factor. It's only Ayurveda which tells us that any one of these aspects will disturb the Vata, Pitta, Kapha, the balancing forces, which can give rise to a lot of diseases. Right. So, another typical thing, I had a 38-year-old female who was a vegetarian, with no known risk factors, with just chronic iron deficiency, presenting with pyrexia of unknown origin, and she had cervical adenopathy. She had severe anorexia with cervical adenopathy, which we worked up and we found that she had Hodgkin's lymphoma. So again, nothing very conventional, no big risk factors to say that this is why she would have developed it. But the very interesting factor was that because she was having fever going for a very long time, somebody had advised her to take a very nutritious diet. So she started taking eggs, which she was never used to earlier. She was trying to take everything that is anabolic according to her, high protein, high fat. Despite having a severe anorexia, there was a lot of ama accumulation that was happening. And that was interesting. And that to me meant something in that particular disease. So point is, Nidana is very, very important. Am I saying this? No. Charaka says, Samshodhanam, Samsharanam, Nidanasya Varjanam. These are the three things that are the most important things in a disease. Sushruta says, Sankshepata Kriya Yogo Nidana Parivarjanam. The great stalwarts like Charaka and Sushruta felt the fundamental thing you do in a disease is to identify the cause and remove it. That increases the chance of your treatment of the disease effectively. So therefore, one of the best things that Ayurveda offers for integration is Nidana. Then, what is the next thing that it offers? The sequential use of Aharam, Viharam, Vicharam and Aushadham. It's not rushing into medicine, but it's starting from food, because food is the basic biochemical that by which the body is building itself on a day-to-day basis. Lifestyle is the basic necessity that the body has to take care of. And Vicharam, or the state of mind, the kind of thoughts, are the overriding energies which are molding the matter there. It is mind over matter always. After correcting of these things only, one is supposed to approach Aushadha. Now again here, nowadays we find many fanciful diets in the name of Ayurveda being spoken about by different people. So it's very, very important to understand that in Ayurveda, there is no single cancer-based diet, right? Because Hita Hitvesati Ekantanemo Anischitaha says Bhagavata. There is no certainty that this thing is always Hita and this is always Anhita, particularly in a diseased person. So Shruta talks about Ekanta Hita. Ekanta Hita is generally for the Swastha rather than for a Atu. So therefore, there is no one single cancer diet. It is highly individualized based on the dosha sthiti, the person's Agni, and so many factors. We'll come to that. But some important concepts are the concept of Amapachana, being very judicious in administering diets or judicious fasting is extremely important and critical in the management of most diseases, including malignancy. So understanding that is very, very unique and offers a tremendous advantage to any system in handling their patients. Then we should be aware that according to the disease, the diet will be different. For example, if kapha is the dominating dosha, we have a low fat, high fiber, millet-rich kind of diets. Although we can try so many other things in Ayurveda, pitta rakta, avoiding a spicy or sour kind of diets is very, very important. In tridoshaja kind of situations, where there's a terminal malignancy or something, giving a light deepanapachana kind of diet, which is still nutritious, or brahmana is very, very important. So the diet will vary on different situations. Ayurveda does not advocate only one diet as one suit fit every size. So the other thing that people need to know from the modern side is the concept of personalized regimes. Now these are going to come in a few years from now based on genetics, and they're going to be terribly expensive. But hundreds of years ago, we have Charaka, Shushta and Bhagavata talking about how to personalize a regime. He says, Dusham Desham Balam Kalam Analam Prakritim Vayah Sattvam Satnam Tatha Ahara Avasthascha Prutakvitha Sukshma Samikshesham Doshaushate Nirupani Yovartate Chikitsayam Nasa Skaladi Jatuchit. Says, please look at these 10 factors. What is the dusham? What is the tissue that is getting affected? What is the desham? What is the country in which he is living? What kind of desha is he living in? Which desha of the body is getting affected? What is the bala of the person in the body level, in the mind level? What is the kala in which this is happening? The dosha, the vyahi kala, as well as the season in which this is happening. What is the Agni status of him? What is his prakriti? Pitta prakriti people tolerate chemotherapy very badly. This is known to every Ayurvedic person. But unfortunately, that's not known to modern medicine. Just a simple knowledge of Pitta Prakriti can save so many people from miseries. Pitta Anubandha Prakritis and Pitta Prakritis do very badly. Vayaha, age. Sattvam, the state of mind, the strength of their mind. Satmyam, what are they comfortable with? Some people are inherently uncomfortable with kashayas. Ayurveda Vaidyas, I find loading them with a lot of kashayas and they're literally refusing to eat foods and they're getting malnourished as well. We see that extreme also. Knowing satmya is very important. Tatha satmya, ahara satmya and avastha. So these 10 factors should be taken for dosha nirupana and aushadha nirupana. That is what is personalized medicine, even at its best. So this has been spoken about by Bhagavata 1500 years ago, Charaka 3000 years ago. So another curious phenomenon that every practitioner sees is the good responders. You have some people responding exceptionally well with one particular medicine. And that excites people that, yes, I'm also treating cancer. But what we need to know is why did he respond? We need to analyze according to these 10 factors. And do we have an answer as to why he has responded more than the next person? Understanding that is important. Otherwise, Charaka says this is yadrucha. It is only by chance that you have treated it. It's not the science of Ayurveda. Then Vihara. Many oncologists are not aware of the importance of dinacharya. Waking up early morning, sleeping at night at a particular time, having food in time, having major meals before the sun is gone to the midpoint, when somebody is hungry. So eating, waking, sleeping are very fundamental. Ashtanga Hridaya is talking about them in the first chapter. So a BAMS student reads about them in the first month of their entry into the college. and these are not discussed even at the end of our MD training, and until somebody is personally very fascinated by it. Rutucharya, seasonal routine. How do you adjust to a changing routine? We are part of nature, so when the nature is changing, how do you adjust yourself? These are very, very important in causation of diseases. Adharaniya vegas. Somebody is hungry, continues to work. Doctors have, I'll tell you a very interesting statistic. The average age of an Indian, educated or uneducated, is 68 years. And a recent study found the average age of an Indian doctor is only 58 years. So it shows the importance of these first 14 chapters of Ashtanga Hridaya, which are talking about dinacharyas, rutucharyas, rogotpatti, dharaniya vegas, adharaniya vegas, dharma acharan. Something again we are forgetting to discuss again and again. Being truthful in our work, being sincere in our work, not lying for the sake of a livelihood, practicing non-violence to live and to let live. That's how life sustains itself. So these are some very important concepts that actually help sustaining life, sustaining health. Then increasing apunarbhavam, says Charaka, making sure that recurrence does not happen. How does this happen? And increase the quality of life. So the concept of achara rasayanam and rasayana prayogam, there's something called as how a person should live if he has to take something called as rasayana. I'll not go into the detail of it, but just like I was saying, satyavadinam, akrodham, being truthful, not being angry, nivrittam majjamaithuna, not being, giving up completely alcohol and sex. Ahimsakam, anayasam, not indulging in himsa, not troubling somebody by their mind, words, or by body, etc., etc. These are very important for some medicines to work upon us and give us that extra life and extra longevity that rasayanas actually do. So achara rasayanam with rasayana prayogam is a wonderful concept that Ayurveda is talking about for entire humanity, both as a preventive measure as well as a treatment measure. Then finally coming to medicine, Aushadhi. Now many people disregard Ayurveda or any other complementary system of medicine without understanding some very fundamental facts. Many chemotherapeutic drugs are of plant origin. For example, paclitaxel is taken from Taxus brevifolia bark. Vinblistine and vincristine are taken from Vinca rosea or Catharanthus rosea as it is called nowadays. Arsenic trioxide, which is being tried in a variety of AML, has been used for centuries by Rasa Shastra for the same kind of diseases. So it is possible that medicines can come from the East other than the West. All that is needed is a systematic study or an unbiased study to actually try to look at these medicines. And another very, very important thing is to differentiate Ayurveda from herbalism and quackery. Actually speaking the truth, many popular cancer treating centers are strictly not Ayurvedic. So now what is strictly Ayurveda? We can define this also in two ways: legal Ayurveda and theoretical Ayurveda, conceptual Ayurveda, Siddhanta Ayurveda. So legal Ayurveda, yes, most of the popular practitioners barely have Ayurvedic techniques. So whether that is a representative of Ayurveda is another question. Second thing is conceptual Ayurveda. Ayurveda is based on Darshana Shastras, understanding Panchamaha Bhutas, Vimshati Gunas, Sattva Rajas Tamo Gunas, Paradi Gunas, and juxtaposing this on every health situation that arises. That is Ayurveda. Without this logic, it is not Ayurveda in Siddhanta. Right? So that people need to understand what is true Ayurveda. Shamanam, yes, this is what is another thing that Ayurveda commonly helps, mitigating the side effects of conventional chemotherapies or conventional therapies. In chemotherapy, conventional Pitta Shamanam by any means generally does help a lot. Surgery, Vranaropanam protocols help a lot. Radiation, Krita, Kshira Prayogams help a lot to undo the fibrosis and everything. Immunotherapy, Ojovardhanam by any means helps a lot. So this is what Ayurveda can offer in terms of overall care of the patient. The one thing I did not talk about is Panchakarma. In a fit patient, yes, changing the basic biochemical milieu by means of Shodhana is another thing that is a peculiarity, a very unique offering of Ayurveda to the current conventional care of a cancer patient. So let's come to the other way. Integrating modern medicine with Ayurveda, what the Vaidyas need to. Because I'm supposed to represent both the systems, so I'm taking both sides. So kindly excuse. So first thing is, cancer is not a single disease. Because you ask any oncologist, they will tell you cancer is not. Lung cancer can be of 15 varieties, 20 varieties. Just saying lung cancer doesn't mean anything for an oncologist. So you need to know exactly what variety of lung cancer it is, what is the genetic aspects of it is, etc., etc. The second thing is to do a proper therapy of treatment of a cancer patient. It is very important to see the patient physically, at least online. We have many cancer centers doling out cancer drugs, but people standing in queues. Am I saying that's wrong? That may not be wrong, but they will do one much better if they actually see the state of the patient, even once, and then decide what to do, if they understand what Ayurveda is all about. So seeing the patient physically is very, very important. Third thing is, another very important consideration is, every Vaidya treating cancer need to diagnose the particular case in Ayurvedic terms, irrespective of the modern medical diagnosis. Is he dealing with a Arbuda? Is he dealing with a Gulma? Is he dealing with a Prana? Is he dealing with a Gandamana? Is he dealing with a Jwara? Is he dealing with a Pandu? What is he dealing with in Ayurvedic terms? That is very, very important to treat, because he can only treat cancer as a variant of this diagnosis. He cannot treat the cancer as such. So that is very, very important. Already, as I said, identifying the Nidana in that particular case is extremely important, because Nidana Parivarjana is 50% of the job done. In cancer case, it may be less, but it is very, very important, particularly in stopping recurrences. Identifying the Samprapti also is important, because Samprapti Vigatana is the main goal of the treatment. Then identifying the specific doshas involved, not treating a diagnosis, but treating a dosha with a dominant guna in its taratama bhava. Rukshatvam, karatvam. Is it in which bhava is it? That is very, very important in the selection of our drugs. So understanding it in those terms is very, very important. Again, realizing the sadhya, asadhyata of the disease. What is the textbook saying? Is this sadhya or is it asadhya? Because before we do an adventure, we need to know what the acharyas have said. Realizing the importance of early diagnosis is again extremely important. If you miss the diagnosis early, you're not giving the patient a chance to survive in many cases. Understanding paraneoplastic syndromes, which are presenting features of syndrome. Patient comes with a neuropathy, weakness in a small hand or foot, but actually diagnosis is a cancer sitting in the lung. So looking at understanding the concept of paraneoplastic syndromes and keeping an eye always open for cancers as a possibility in the high-risk groups is very, very important. Then having an unbiased assessment of the Chikitsa Chatushtaya. How much of Sampath am I having in my Chikitsa Chatushtaya? Which is, how good a physician am I? How good is my Dravya? How good are my support systems? And how good is the Rogi? In all the 16 aspects described by our Acharya. This understanding is very important before deciding to treat a patient. I'm talking this predominantly for the young students who want to understand cancer care, rather than for senior practitioners who already understand this very well. So it's not just limited for them. And Bishak, as we all know, it's very important that you know the proper fundamentals of your system, and you have seen a plenty of practicals with your guru before you are doing your first treatment of a cancer. That's very, very important. Experimenting with a disease as severe as a cancer in a patient can be criminal, because it might cost the life of a particular patient. So make sure you're working with somebody experienced, understand reasonably well before actually treating those cases. Dravya Sampath, very important. What species of the drug are you talking about, of the herb are you talking about? Which location have you collected it from? What season have you collected it from? What method of collection do you employ? What are the preparation methods that you have done? Are you following all of these things to ensure that the drug you are giving has proper sampat, it has got the best of its quality? Because cancer has roga bala of the highest degree, therefore your dravya should have its highest bala. Otherwise, you're not going to counter it with weak medication. And like I said, important not to miss a diagnosis in undiagnosed cases, not to delay treatment. If a patient is coming to you without a diagnosis earlier, being a clinician who can diagnose it is very, very important. Patient education. If Ayurveda has to keep up its repute and not fall into disrepute, it's very important that we educate patients correctly. Sadhyam asadhyam. Is this doable or not? Credible data-based previous results. I have treated 100 patients earlier. 30 survived, 70 did not survive. Do you want to take this? It's a question that somebody should have the courage to tell. Is the answer somebody should have the courage to tell. Costs involved. My medicines involve gold. It is costly. Can you afford this? This has to be used for so much of duration. Side effects. We need to acknowledge that medicines will have side effects. If you're using malla, if you're using arsenic, if you're using bhallataka, if you're using drugs like this to treat a major disease, there's a chance that somebody will have side effects. We need to warn them that please, it's possible. Anything when we're treating a major disease with potentially Viryavattara drugs, side effects is a possibility if you are not careful in A, B, C, D. Then judicious and appropriate dietary restrictions. Dietary restrictions cannot be one size fits all, like what we discussed. What is appropriate to that particular patient? Avoiding malnutrition is very, very important. Patya, like I said, judicious use of lankhana or fasting is very, very important. Taking into account the nutritional needs of that patient. Most advanced cases have cancer cachexy. Avoiding cancer cachexy, malnutrition, further malnutrition, saying don't take milk, don't take non-veg, don't take egg, is dangerous if we don't understand the nutritional state of that patient. We have Charaka saying this, Prana virodhina chainam lankhanena upapadye baladhishtanam arogyam yadartho ayam kriyakrama. So our lankhanam should be prana avirodhina. It should not be obstructive to the survival of that patient. That is very, very important because bala cannot be lost. Bala has to be maintained. The whole idea of treatment is to increase this bala, not to reduce it. Again, ensuring a time gap with modern medicine to have clarity on if there is a side effect, which is causing the side effect. When there is a cycle of cancer chemotherapy going on, stay away till that particular phase is over and then try if you are giving a drug which is Usnavirya or which is Katurasarase. Otherwise, it's only going to increase toxicity and we will not know which drug caused it. The patient will not know which drug caused toxicity. End of the day, the patient needs to know which drug is troubling him. So giving that time gap on a day-to-day basis or in a cycle-to-cycle basis. Then use of modern diagnostic with due understanding and diligence for diagnosis, monitoring and data record. Very important. Tomorrow, if future has to respect Ayurveda and we have to be Vishwagurus again, it's paramount for us to record our results very, very carefully. It can be a very basic parameter, but maintaining standards in recording our data, particularly with investigations. It can be a simple investigation, an ultrasound. Make sure the observer is the same. It can be a CT, wherever it is necessary. So whatever we are choosing, we need to understand the laboratory investigation correctly and use it with due diligence. Cannot use it without understanding. It's very, very damaging to the system to do that. Like I said, I have seen very senior Vaidyas, very good Nadi Vaidyas, miss early gallbladder carcinoma, resulting in death of some patients as well. Not to blame, but I'm saying that in my experience, I feel modern diagnostics are always a fallback, they are always a plan B to make sure that we are not missing something without being over-reliant upon them at the same time without being, using them judiciously. But to do that, you need to understand the limitations and side effects of the diagnostic modalities. A very common thing I see is that Vidal does not talk about typhoid. It is not a diagnostic test for typhoid at all. It's an irrelevant thing to this talk, but I'm just telling you. Many practitioners I see are treating typhoid by Vidal. No medical practitioner does it, or properly educated medical practitioner does it. Only when Vidal is increasing by threefold within 2 weeks' time, it is diagnostic of typhoid fever. Otherwise, it's not diagnosed. So, same thing, HbSH is positive. Patients may not need treatment until HbEAg is positive. And the patient is infective and the infection is active. Similarly, a CT scan and PET scan can cause tremendous irradiation. For example, a CT abdomen is equivalent to more than 2,500 X-rays, and a PET scan is equivalent to more than 6,000 X-rays if somebody is doing whole body PET scan. So imagine a patient getting irradiated just because the suggesting Vaidya doesn't understand this. So please understand the investigations and use them diligently, but that is important. Then auditing by governmental agencies is very, very important because of mushrooming of cancer care centers, which nobody is sure whether they are authentic or not. So governmental agencies need to be auditing them in terms of their results, their standard practices, etc., in order to maintain the sanity of IT and sanctity of IT. Finally, my third, I'll just take 5 minutes, I'm almost done. So finally, third type of integration is a patient-centric integration, wherein both systems are working in tandem, preferably under the same roof, but as a team, just like 11 players play cricket together to win, playing like that, not as rivals fighting against each other. Working for the betterment of patients and not for individual betterment, not for financial betterment, not for system goals or egos. So interest of the patient should be at the center of every decision. What is the type of disease? Is it a surgical disease or non-surgical disease? What is the cost of therapy that you're going to offer? Can the patient afford it? Is it curable or palliable? What is the patient choice? Does he want it or his maternal uncle's friend want it? So what is the preference of the patient? All these need to be taken into consideration before embarking on the cancer cure. Informed and conjoined decision, excluding financial and marketing bias from taking decisions based on for marketing reasons. I've started a center, so therefore I have to enroll somebody to do the panchakarma. That's very dangerous. So for this, my best model has been Dr. C.P. Matthews' model. I'm sure many people are aware of it. Just to give the previous example, I started with the 40-year-old software engineer who had high-grade B-cell non-Hodgkin's lymphoma with CNS infiltration, post-chemotherapy, post-bone marrow transplant, post-CAR T-cell therapy. It costed them a whooping 2 crores. CAR T-cell therapy is a new therapy. Hardly 100 people have undergone that. I'm informed. And this patient was one of them. And despite that, it costed them 1.2 crores just for that therapy. And presently, the patient is almost pre-terminal. At least that's what they have declared to the patient. And most depressed. And what depressed him was that the way physicians have been talking to him. So my point is, we need to look at the patient and then decide the therapies. Ultimately, what is it doing to the patient? So the Dr. C.P. Matthews model is talking about a single person who's trained in both the systems with the right aptitude, the right attitude, right motivation, dedication. I'm sorry for the spelling mistake. And doing it perfectly as a karma yoga. These are you need to look at the qualities in the person to inculcate this kind of a model. So, end of the day, using all of these things, aharam, viharam, vicharam, aushadham, chemotherapy, radiotherapy, immunotherapy, and surgery, keeping the patient in the center and then taking a decision, that is the best interest of the country. But that's a big dream as of now. And coming to how to make that possible, I'm just quoting this from Mahabharata, which says, for teaching that kind of Vaidyas or teaching that kind of students, what is important? Acharyat padamadatte padam sishya swamedhaya kalena padamatte padam sa brahmacharite. Acharya, finding the right teachers to teach the students is the most important thing that government needs to do. And then finding the right students to get taught by them is the next thing, with adequate medha, the right kind of utsaha and shraddha. Saha brahmacharis or shastra, 2 versions are given. having the right environment that is being created, and time is the last thing. It is very notable that infrastructure is not discussed in this shloka of ancient teaching and learning. So having our priorities right is very, very important. Finally, I end my talk with this with the last verse of the Rig Veda. Way back in the Vedic times, they conceived such a beautiful thought when they uttered this, when the great Rishi by name Samvarana uttered this beautiful rik, which says, Samgachatvam, Samvadatham, Samno Manansi Janatam, Deva Bhagam Yatha Purve, Samjanana Upasate, Samano Mantra Samitis Samani, Samana Manaha, Sahachittatam, Samanam Mantra Mabhimantraye, Vah Samani Navaho, Avisha Johoti. So it says, let's walk together, talk together, let your minds apprehend alike. Just as the ancient devas or the most educated persons of those days concurred accepting their portion of the sacrifice, let our prayer be common, common be our acquisition, common be the purpose, and common be the associated desire. So for this, we offer our prayer. Samanaha akudi, samana hridayaniva, etc. So common be your intention, common be the wishes of your heart, common be your thoughts, so that there may be proper union among all of us. I thank the CCRS, Dr. Govind Reddy sir, Dr. Manohar Gundeti, Dr. Sudha Sinha and Dr. Shanta, my colleagues, for my presentation, for the contributions. Thank you very much.
Thank you, sir. This is really, what I say, one of the best lecture I have heard from you again. Thank you very much. And we are privileged to have you as a particular on this topic to see your thoughts on this. And it was really interesting to see because we always hear like thoughts from either this system or that system experts. But very few are there now. After Dr. Ashok Vaidya sir and other people, I think you are the next generation, the expert who can speak in a dual language. So thank you very much for your this very thought provoking and rather, I mean to say this needs a lot time to digest and to work on that. And very interestingly, you talked about the patient-centric integration. That is what is needed. The right aptitude, right dedication, and right commitment. And India needs the affordable cancer care and accessible cancer care. And coming together, that is the only solution. This what I think and what I gain from your this interesting lecture. Now the floor is open for the question and answer. I could see almost 200 people are there who attended this particular webinar, and it's also live streamed on YouTube.
लिंक गलत भेजा, तू दूसरी लिंक भेज रहा है मेरे को।
So
लिंक गलत भेजा भाई।
वहाँ क्यों? उसी लिंक पे तो मैंने ये डाउनलोड की पास में।
To start with any questions from there are participants who have posted questions. Shall I take sir the questions?
Yeah, sure.
Yeah, okay. So one question he says, Sarvesh Raut, good afternoon, sir. Myself, Sarvesh Raut, research scholar working on phytochemistry of medicinal plants, and I am stuck on the trials of formulation. Can you please guide me? Like clinical trials on experiment animals like albino, rat, mites, from where should I start? I think, okay, but you would like to answer? Okay,
like I said, see, there are two things, Dr. Sarvesh. See, if you're looking at identifying at a molecule, then actually you're going in the first way of integration. You're going to enrich modern medicine. Please have that clarity. And yes, you should look at the fantastic responders. If somebody has responded very well, you start from there. You start from the patient who's responding very well. From any place, it could be a herbal practitioner, it could be a tribal practitioner, but patients who are responding, start from there, go with reverse pharmacology, try to get to the drug and try to see the cancer versus the drug, but also use what we discussed, the 10 parameters that the Rogi Pariksha and the Roga Pariksha that we talked about, and then you can probably land with the right plant.
Thank you, sir. Dr. Muhammad is asking, lorlatinib is the drug usually used for NSLC, where major side effects are including CNS effects and hyperlipidemia. So, how we can plan for chemoadjuvant and add-on therapy for this specific drug, and also kindly explain that whether considering all the chemo and radio drugs will aggravate only pitta factor, or according to the drug chosen we should alter our protocols, or else only those assessment of persons we can decide these protocols. So whether integration will be of person centric drugs which has choosing centric or drug centric.
See, obviously we need to choose based on the patient and his doshas. I mean, pitta is generally what I'm trying to talk about, but we have many situations wherein all the three doshas or a combination of doshas, that can be sannipata, whatever that can be aggravated. So obviously a proper assessment, I already discussed, needs to be done. You need to look at the patient, have a diagnosis made in Ayurvedic terms, and then decide what you need to do. Talking about monoclonal antibodies being used as immunotherapy, see, the whole idea is modern medicine is believing that by using that particular monoclonal antibody, it is activating the B cells and T cells. It's activating the cellular immunity to increase the efficiency of cancer surveillance or increasing the efficiency of cancer cure. So for us, we can help that process by our Orjovartana kind of processes. We believe that Agni and Ojas are two very important aspects of increasing one's immunity. Agni in the short term and Ojas in the long term. So by balancing Agni, by increasing Ojas, by balancing three doshas, that's the best we can do to make sure that that particular drug does better than what it is destined to do. Because his immunity also will be adding to it. You need to know that most of the monoclonal antibodies, they're short-lived in action. But if we do proper Ojovartana, you will find that they're actually working for a longer period of time. Hello? Hello?
ये ना यहाँ से अनम्यूट हो गया ये स्क्रीनशॉट ले लो
Anything else, Dr. Manohar? Yeah.
स्क्रीनशॉट ले लेना स्क्रीनशॉट कैसे करना भाई बता ना अरे यार ये तो ऐसा हो रहा है पर डाउनलोड नहीं हो रहा मिला ना ब्रो मैं
Dr. Manohar, am I audible? Not able to hear you.
Sorry, I muted myself. Sorry. Namaste, sir. This is a comment from B.S. Krishnan. A happy and proud moment for Ayurvedic students or followers to get insightful knowledge about how to integrate our science to contemporary science. My query is, please guide us how we can understand Ayurvedic aspects to be related with different type of cancer. Also, how can we administer Ayurvedic medication to a cancer patient who is already with chemotherapy to improve immunity and to prevent the adverse effect of chemotherapy?
Yeah, I think I discussed the same thing. But see, basically, in my outlook, Ayurveda can be used in four types. One is to treat the tumor itself. Second is to stop the metastasis. Three is to prevent recurrence. Four is to reduce the side effects from chemotherapy or whatever conventional care that is happening. So broadly, these are the four mechanisms, four methods by which we can address cancer patients. So first of all, whenever you're selecting a patient, you need to identify which one of these four things do you want to do for that patient. What does the patient need and what is he ready for? That plus understanding the disease according to in our terms will automatically lead us to know which drug is my best, which is the best drug I can select. To this, you need to add what is the modern oncologist doing to the patient. For example, if somebody is on methotrexate or any other drug, you need to understand that in our the rasa panchakam, if we look at methotrexate, what is its rasa, what is its guna, what is its virya, what is its vipaka, what is its prabhava? When you understand this, by, let's say, even theoretically understanding or seeing the common side effects and everything, your drug selection will become simpler. You can choose a drug which is not going to worsen those side effects, but is still against the basic dosha and the basic roga. So balancing against, it should be against the roga, against the dosha, but it should not worsen the side effects of the given therapy and should complement it. That's how you can go ahead with treating patients. But like I said, make sure you're working with somebody who has already done this so that you're not doing an experiment on them, as cancer is a severe disease that cannot be experimented upon.
Yes. So there is another question. Dr. Hemalata, she is asking. Namaste sir, could you please explain in Pitta Prakriti person and advanced stage of person with aggressive variety of cancer, shall we use Shodhana and Rasabhasma treatment?
Shodhana by itself, now if you read our textbooks of Ayurveda, they themselves are saying who are Arha and who are Anarha for Shodhana. So you cannot do Shodhana in somebody who's already having an Atikarsha or Atiyoga of Vata. If somebody who's having extreme degree of Dhatukshaya, they are not the typical persons who can undergo routine Shodhana. You can only do very selected kind of Shodhana, like Kshiravasti, or you can do select types of Shodhana. You cannot do random Shodhana for them. So again, it comes to the point, have we understood our fundamentals correctly? If you want to employ Shodhana, are we sure that this person is Vamana Arha, or is he eligible for a Virechana? Is he eligible for a Vasti? And how is it going to help him? What is the dosha that you're trying to treat? If there is a Sannipata condition, first, which dosha you want to treat, etc., etc. So again, if you can understand the fundamentals from the text, these decision making will automatically be done in the sequence that the acharyas have discussed. And Rasabhasmas, yes. See, whenever you are facing a big disease, you have to give your best shot at it. So you have to give your best medicine against it. But when I say that, I already spoke elaborately about Dravya Sampat. How sure are you that the drug is safe? Can you give it to your own family without feeling afraid of it? Are you sure that the drug has been collected properly, processed properly, and its Shodhana has happened correctly, and the whole process that textbooks have spoken about have taken place or not? If the answer for all this is yes, obviously you should give your best bet at it. But if your Dravya Sampat is not proper, if you're not sure about all these things, then, like I said, the answer is very simple. If you can give the same medicine to your family member, then likely that you can use the medicine.
There is another one question Dr. Muhammad is asking. What about drug interactions, sir? When we are giving Pitta Hara drugs such as Avipatti or Arogyavardhini Vati, cause our medicine is not working on the organ or receptor specific.
See, again, we are not, our system, Ayurveda is not designed to think about receptors at all. In the sense, have we analyzed it in our terms correctly? Like I said, if you are looking at Pitta, what is the guna of Pitta that you want to treat? Do you want to treat the Ushna guna, Tikshna guna, Saraguna? Which guna are you trying to treat? What is its Taratama Bhava? Is it mild, moderate, or severe? Now, what is the Sampat of your Arogyavardhini? Did you prepare it yourself? What is the process you used for Nimbapatra Swarasa? What is the process you used for Kutiki? From where did you process your Kutki? These things are important. What is the season in which you have collected your Kutki? If you are sure about all these things, then balancing it is not difficult. If you are taking from the market, using it because somebody said Pitta Shamana is good for chemotherapy, then there is a problem. Have you understood the disease in your terms? Have you understood your drug? Your drug is your weapon. Have you understood your weapon correctly? If you have understood the disease, if you understood your weapon, it's not a big issue. You can solve it.
Vaidya Jaiprakash Ram is asking, chemotherapy drugs are generally cytotoxic. Can cytotoxic drugs be treatment for any disease ever? especially if it is to be given in multiple cycles?
That's a good question and a very interesting question. If we can find an alternative, I said, see, that's why I said integration is of 3 types. And I said my second integration is using modern medicine to enhance Ayurveda. At least I'm a believer of that. If we can come up with a better cure, with a better therapy, yes, why should we back toxic medications? There is no need to back them. But having said that, is it completely unprecedented? The answer is no, because we use, if you read our Visha Adhyayas, we are using Visha as a Prativisha, but at an extreme stage of the disease. So use of Visha has been recorded, has been in vogue, but in extreme and advanced stages of disease in Ayurveda. Modern medicine is using it in a similar situation according to it. The idea is whoever comes up with a better solution,
Take the sign
that
that
will take over. So come up with a better solution. Yes, we don't need toxic medications. The patient will never need forget systems. Patients will not see.
Okay. Dr. Anupama, can you please mute yourself? So now, sir, there is one question. Dr. Gayatri is asking, what regulatory frameworks are needed to standardize Ayurveda-based intervention in oncology?
Again, not my realm to answer that. Dr. Manohar may be a better person, but I will try to venture into that realm. I will say that first we need to have a body of the regulatory authorities who are good Vaidyas. And I'm very happy Dr. Manohar is actually sitting on that forum. Because if you are not a good Vaidya, you will not understand the system and you cannot know how to regulate it in the first place. So having the right people in the right place is the first step to solve this problem. But it's a long journey and there will be very uncomfortable questions asked in the way.
Sure. Okay. So to just brief one small information to again this audience is that Ministry of Ayush and ICMR has came together for setting up of Advanced Center for Integrative Medicine Research. And this has been started in last year where a couple of centers have been started across India in various aims. And one of the aims in Nagpur, they have started research on cancer. So there is the integrative oncology. So there are efforts from the regulatory side also. So as Dr. Shankar Prasad is telling that a long way to go, but over the period of time this will evolve. Yeah. So sir, there is one question, and I think with this maybe we'll stop. Vaidya Jaiprakash Ram is asking, is biopsy responsible for metastasis?
Yes, if done irresponsibly in some cancers, yes. If it is crossing cell boundaries, if it is crossing vascular boundaries, it can contribute to metastasis in a very small way, in a micro metastatic way. Theoretically, yes. But usually some safeguards are taken to minimize that possibility and biopsies are being done.
Dr. Anupama, can you please mute yourself? Sir, there are no any questions as of now, but just I have one question for you. What made you to pursue the career in Ayurveda after having your this much of career in MBBS, MD, and then DNB? This is just out of the context question I am asking to you. So maybe
two reasons, Dr. Manohar. One is my fascination with the Veda and the kind of truths that the Veda talks about, which are just mind-blowing, number one. Second thing is, when I was studying my MBBS, one day I went to National Institute of Nutrition Library to prepare for my MD, and I and I opened Charaka Samhita, and it was about shocked when I read that somebody can correlate the type of hair with the type of metabolism. It was amazing to me. So many bodily features, everything under one roof, and being explained by one kind of thought process. And that seemed very logical to me when I applied it to my immediate friends and family. That was really very significant to me. I said, what I was wondering was, how is it that somebody like this could predict like this? If somebody is having this kind of hair, if he's having a bald head, his basal body temperature will be high, or he's prone for asthmatic disease, he'll have more thirst. How can you do this? Because there's no technology in modern medicine that can do that. That curiosity of mine, with probably my traditional respect for Veda, made sure that I wanted to explore Ayurveda. Another thing on a personal front is that medicine is very scary because we read about so many possibilities without any cause. Suddenly cancer can happen to somebody without any reason. Suddenly you can fall sick. You can have a common cold and end up with Guillain-Barré syndrome. Reading Ayurveda helped me understand that actually that's not true. Only when your doshas are imbalanced because of your ahara, vihara, and vichara, then you become prone for a particular disease. So that was very reassuring. Lastly, at that point of time, even if I take a paracetamol, I had serious side effects with it. So I needed to know something if I have a health issue. So I had no option as well. So my karma, I would say, my destiny.
Interesting. Thank you, sir. Sir, someone is asking to share your contact number. Professor Vaidya Kiran, Om Prakash Mantri, if you agree, then I can put it here, or we can send the email ID to them.
Yeah, we can share the email ID and 98481-57629. That's my number. So I can share it in the chat later on to Dr. Manohar. Yes, I can do that. That's not a problem.
So, sir, there are two questions. Then we'll take and we'll stop it here. One is patient with breast cancer and colon cancer. Could you explain Ayurveda management with allopathy? And another is, how true is that, be it any type of cancer, milk and refined sugar are a big no-no?
See, the first question, I have already answered. See, I am saying that if you want to treat carcinoma of colon or carcinoma of the breast in Ayurveda, first of all, stop calling it as carcinoma of colon or carcinoma of breast. I'm saying, please say, what is the diagnosis there? Have you made a diagnosis of Arbuda? What kind of Arbuda is it? Is it a Vrana? What kind of Vrana is it? What is the dosha samprapti there? What is the predominant dosha involved in it? That should be the approach you are making first of all. So if you make your diagnosis correctly and refer to your textbook, the textbook will tell you it's Satya Satyatva, whether you can try something for it or not. In general, yes, then you do your Rogi Pariksha and Roga Pariksha. Your drug selection also will become pretty natural. So then I said, I gave you the 4 approaches. Do you want to treat a tumor? Do you want to treat metastasis? Do you want to just do Ojo Vardhana? Do you want to pacify the side effects? Ask the patient what do they want. That will make it even clearer for you. And that will lead you to drug selection. So if you're expecting me to tell you for carcinoma breast use A, B, C, D, then I'm contradicting the 45-minute lecture I made just now. So drug selection should be based on at least Desham, Dusham, Balam, Kalam, Brakadam, Manalam, Vaya, etc. And so is individual. We can only discuss the principles of drug selection, not the drug proper, is what I'm saying. Another point is that if we as Vaidyas give so much importance to Aushadha without understanding the Nidana and Samprapti, then we should relook our text once again, because we need to first get the Nidana out and then look at the Aushadha. Yeah, I agree that cancer needs an Aushadha, 100%, but I'm saying that Nidana is equally important.
Sir, a comment, Dr. Ashwini Kumar Rao, sir is saying that very interesting presentation and responses. Congratulations, Dr. Shankar Prasad, and thank you for that valuable discussion. Sir is an integrative medicine practitioner in Mumbai. He practices rheumatology and arthritis integrative way.
Milk and refined sugar is still pending.
So there is that Milan Mehta is saying that the milk and sugar, refined sugar. It's a big no. Yeah.
See, if, like I said, yes, see, anything, Arbuda, if the diagnosis made is Arbuda, then yes, because Arbuda is a Kafaja Vyati, and in the Samprapti or in the Nidana, we are finding that the person is a sweet lover, has got a sweet tooth, and that is contributing, then yes, cutting that off is very, very important. But Kshiram, let's say, in somebody who is extremely emaciated, who's got a stage 4 disease, he needs Agni Deepana, then we have to process that Kshira and probably give it in small quantities in a diluted way, because nutrition is very, very important. If the patient is a vegetarian and doesn't want to take eggs or other diet, then for us, we have to, if you cannot just stick to Yavagu, you cannot stick to Manda, Peya, and we need to we need to give some kind of nutrition. We need to think of Ojas as well. So administering Sneha is very, very important, because Snehameva Param Vidya Durbala Anala Deepana. Rogamuktasya Mandagno Sneha Evacha Deepana. So once there is little bit of Agni Deepana, there should be Sneha to do further Agni Deepana. Therefore, yes, milk, I would consider after processing it with, let's say, a Shunthi or with a Haridra or some process like that, or maybe with diluting it or doing some process to it to make it more Lakutara.
Thank you, sir. Lastly, I think this may this very important question and maybe a comment also. Shall Ayurveda be a primary or allopathy in integrative management of cancer? Which would be better approach? I think with this we can conclude the sessions.
Very difficult question to answer. My wish is that it should be Ayurveda. But for that, we need a whole ecosystem to come up, wherein we have good teachers, good acharyas, we need good sishyas, we need a good support from all around the society with adequate respect for that system, enthusiasm, etc. But my wish is that it should be Ayurveda, not because of my personal bias, but because I have found that the way Ayurveda looks at a person is a more wholesome thing. Someday, I'm sure modern medicine will inch its way towards the way Ayurveda looks at the world and looks at a patient, which it's doing with different names. They call it as functional medicine, they call it as indicative medicine. But slowly they are inching way towards Ayurveda and towards its outlook of life in general.
Thank you, sir, for first of all your sparing the time and to deliver this nice lecture. Almost 2 hours we are there, but I know your efforts were there almost last 1 week. Despite of your busy practice schedule, you could make it to have this presentation in front of all of us, and also the participants who made this session very lively with the very interesting questions and answers from your side again. Thank you very much. There were many seniors, my teachers were there, and thank you, Dr. Reddy, sir. You want to comment, sir? Sir, you are muted. Sir, you are muted.
Excellent presentation. Yeah,
Okay.
very appreciable. Yeah, thank you. Thank you, Dr.
Thank you,
Manohar.
sir. Thank you, sir. And thank you, Dr. Manohar.
Yeah.
It's always a pleasure talking
Thank
to you.
you.
Thank you once again, all, and we'll see for the next webinar tomorrow and day after tomorrow, and there will be one web conference on 19th of September. Please do register. We'll be sharing the flyer soon, and we look forward for again your valuable interactions and having a nice discussion on this very important topic. Thank you very much. Good evening, all. Namaste.
Thank you.